Should you exercise when your knee hurts? This is a common dilemma. Do you keep moving or do you stop completely and rest? Knee pain often creates uncertainty. People worry exercise might make things worse or that movement could cause damage. And we've all been there. I've been there before several times. I've felt in football and wondered what's going on. At the same time, stopping completely doesn't always feel right either. Understanding what approach to take can help remove that uncertainty. Knee pain doesn't automatically mean you must stop exercising. That's quite an important point. But obviously, if you are in mega pain, go and see a physio. Often the discomfort relates to fatigue, irritation, and the load through the joint as well. Avoiding movement completely can actually sometimes make things worse. Your strength may decrease, your stiffness may increase, and your confidence drop. And we don't want people's confidence to drop. This is why continuing to move in the right way can actually help. So pain is a signal, but it doesn't always mean damage. Some discomfort during or after exercise can simply be the knee reacting to the increased load if you're lifting more weights, fatigue, temporary irritation. Understanding this difference reduces fear around the movement. So let's talk about how exercise can help with knee pain. The right exercise supports knee health. Avoid the ones that make it worse, because if you are in mega pain when you do a particular exercise, it's probably not recommended. We just need to work out a plan on how to work around that. But training the muscles around the knees helps build strength, improves control, and it increases load tolerance. You've got your key muscles like your quads, your glutes, your hamstrings, and your calves. And if you can't squat or anything like that, try and work around it. Leg extensions for quads, leg curls for hamstrings, glute drive for your glutes, standing calf raises for your calves. Stronger muscles help absorb force and support the knee joint. Gentle movement also increases circulation and can reduce stiffness. Just modify your training, don't stop it completely. Obviously, not all exercise is appropriate when knee pain is present. Again, I touch on it. If you are in mega pain, don't just work through it. Seek professional advice, okay? You just may need to modify high impact movements, sudden increases in intensity, and exercise that increase pain. Just might need to modify them, that's all. And that modification can mean reducing the load, slowing the movements, limiting your range, or just choosing low impact options. This keeps the knee moving while irritation settles, so we try and work on the underlying issues in the background. Obviously, there's times when to be more cautious, and exercise might not be advisable if you have severe pain, worsening symptoms, swelling, locking, instability. In these cases, like I said, go and see a physio, okay? So if you've got that mega pain, go and get their advice, all right? So support during exercise. Some people find knee sleeves helpful during exercise like squats. I've worn them before. I think they're brilliant. They can provide warmth, compression, and a feeling of stability. They helped with my knee pain as well when I squatted. That's just me. But they shouldn't be used to push through significant pain. Recovery is just important after you may get that discomfort, okay? So helpful strategies may include adequate rest, adjusting your training volume with gradual progression, and icing the knee. I've said in my previous videos, I'm a massive fan of icing my knees. I do it every day. So let's try and adopt a sensible approach when exercising with knee pain. It's not about pushing harder, it's about listening to your knee, choosing manageable movements, and progressing gradually. We all go at different levels, so move at your own level. Pay attention to how the knee responds over days and weeks. It might feel sore the next day or might feel fine. But to summarise, exercise with knee pain isn't about ignoring it, it's about moving in a way that supports long-term knee health. With sensible progression, appropriate exercise, proper recovery, many people can continue exercising while supporting their recovery. Staying active is often both possible and beneficial to your knees.